Hi, this is Auntie Bunny. Today is July the 18th. This is my pre-op day. I am going to be having a vertical sleeve gastrectomy done supposedly on July 26th. My highest weight was 384 when I went in for my first official consultation visit with Dr. Mora. I was at 379, so I had lost a little bit. I just had my final weigh-in with Dr. Mora, which was 374. So I've lost a little bit. But there's a discrepancy because I also had to go to the hospital first to do all my pre-op work. And their weight had me at 370. So I guess in between driving from the hospital to my doctor's office, I gained 3 pounds. How, I don't know. The pre-op process for me, I initially was supposed to be there at 2 p.m. I got there at 1:30. Went to admitting. They did their paperwork and asked a few questions and put a bracelet on me. From the admitting, I went to the lab and they drew like maybe 6 vials of blood, which may explain why I'm tired and weak. From the lab, I went to do a chest x-ray, and from the chest x-ray, I went to have a EKG done, and from the EKG, I went to have a consultation with the nurse that will be in the recovery area and surgery waiting area. She went over the process, explained to me what's going to happen the day of. She couldn't give me a time. She said that normally they call the day before. She went over information about what medicines that I'm currently taking that I should take the morning of with as little as water as possible. Also, to bring my CPAP machine as well as my cane. I only use the cane because I have something called Meniere's syndrome, and sometimes I get dizzy, and so she said that they may more than likely put a fall bracelet on me because of that, and definitely again bring the CPAP. The nurse at my doctor's office, a bariatric nurse, Melissa, informed me that she's going to call in a patch, which I'll need to put on that morning after I've taken my shower, to put the patch behind my ear because it's going to help with the nauseation. I will be nauseated, she said, after the surgery. Again, she stressed the need for me to try to stay on clear liquids from today until whenever. So today, I kind of cheated. It was my last supper meal. I know they say don't fall into that syndrome, the Last Supper syndrome, but I did. So that was my last meal. So from today forward, I'll be on a shake in the morning, a shake for lunch, and if I can, do a shake for dinner and a small salad or something liquidy is fine, but she preferred it just be straight liquids to shrink my liver as much as possible before the surgery. And I want that to go smoothly, so I'm disciplining myself to be straight liquids, which means I'll be stuck in my room because my family loves to cook. And anyway, the next time I'll eat something, a meal, maybe September or October. But that's what my process was like, the pre-op process for me. If you have any questions, hit me up. I'm on Instagram as Auntie Bunny, on Facebook as Auntie Bunny.